She was still healthy the day before. We watched movies together and laughed. Sarah tearfully recounts about Eleanor, her 87-year-old mother, who passed away suddenly one night last October. But when I asked about the months prior, a painful truth was revealed. Eleanor had lost 15 pounds over 6 months. She was often too tired to attend family gatherings. She had been hospitalized twice for pneumonia and sometimes seemed unable to remember her grandchildren's names. If we had known those were signs, if we had understood what was happening, we could have prepared. We could have said goodbye. According to the latest research from the National Institutes of Health, 82% of deaths among the elderly show at least 3 of the 5 warning signs a year in advance. Yet, 71% of families don't recognize these signals until it's too late. They still believe that death in old age happens suddenly, without warning, a misconception that prevents them from making the most of those precious final months. Think about it. There might be only 365 days left. What you do with that time will shape not only your loved one's final memories, but also the memories you'll carry with you for the rest of your life. It could be 365 days of anxiety and confusion, or 365 days of deep connection, meaningful conversations, and loving preparation. In this video, I'll share 5 critical warning signs that most families miss, signs that can appear a year before an elderly person passes away. Some may be things you've noticed but dismissed as a normal part of aging. Others might be so subtle that only trained individuals know how to recognize them. Don't become one of the 71% of families who regret not seeing what they should have seen. This knowledge won't just help you prepare emotionally, but also allow you to ensure your loved one's final months are filled with comfort, dignity, and peace. Join me as we explore the first and most obvious sign, a sign that even doctors acknowledge as the unmistakable indicator of profound change in the body. 1. Major changes in breathing or circulation. Of all the warning signs, nothing makes families more uneasy than noticing changes in their loved one's breathing or circulation. It's a sign you can see, can hear, a clear signal that the body is undergoing profound changes. I'll never forget the call from Maria, a 42-year-old woman caring for her 83-year-old father. "There's something wrong with my dad's breathing," she whispered into the phone, her voice trembling. "He breathes fast, then stops, then starts again. Sometimes I think he's stopped breathing completely." What Maria was describing was Shane Stokes' respiration, a distinctive breathing pattern that often appears in the final months of life, when the respiratory centers in the brain begin to change function. According to a study from the American Medical Association, nearly 78% of elderly people with significant changes in breathing patterns will pass away within 3-4 months. But these changes aren't limited to breathing. Blood circulation also begins to change dramatically. I held my mother's hand and realized it was ice cold. Jennifer, 56, recounts about her 92-year-old mother. "Not just cool, but truly cold. I piled on more blankets, but it didn't help. That's when I understood. This wasn't about room temperature." Jennifer had recognized one of the subtlest signs of circulatory changes, when the body begins prioritizing blood for vital internal organs, reducing blood flow to the extremities. Beyond cold hands and feet, you might also notice changes in skin color. Many families report seeing a bluish-purple mottled pattern appear, especially on legs, knees, or arms. Dr. Jonathan Meyers, a geriatric specialist at Mayo Clinic, explains, "This mottling is the result of slow blood flow beneath the skin. It's one of the clearest signs that the body is transitioning to a new phase." You might also notice your loved one suddenly becoming short of breath when doing things they previously did with ease. David, 81, who had hiked weekly, began gasping for breath when simply walking from the living room to the bathroom. When his son Robert asked about this, David just waved it off. "I probably haven't been exercising enough." But it wasn't lack of exercise. It was a sign that the heart wasn't pumping efficiently, and the lungs were working harder to supplement oxygen. Noticing these changes early plays a crucial role. Meyers says, "We don't try to fix them. We focus on making the patient as comfortable as possible. If breathlessness is distressing, we might provide oxygen. If extremities are cold, we use warm blankets. The most important thing is ensuring the person doesn't feel anxious or afraid about what's happening." For families, witnessing these changes can be distressing, but it can also be a gift, an opportunity to prepare, to be present, to show up. As Maria shared, "When I realized my father's breathing was changing, I started spending every moment I could with him. I sat there, held his hand, and made sure he never had to breathe alone." 2. Extreme fatigue and weakness. We all experience tired days, but there's a special kind of fatigue that appears when the body begins preparing for life's final stage, a deep, persistent exhaustion that doesn't disappear, no matter how much rest one gets. My mother used to be the earliest riser in the house, Kevin. 62 recalls about his 89-year-old mother. She would bake muffins, read the newspaper, and work in the garden, all before the rest of us woke up. But in those final months, she often slept until noon. When she did wake up, she could only sit for about an hour before needing to rest again. Kevin and his family initially thought it was a temporary phase. Perhaps his mother just needed more rest, but this was a sign of a much deeper change. The fatigue in life's final months isn't just feeling sleepy, it's the sense that every activity, no matter how small, requires enormous effort. According to Stanford's Palliative Care Center, 93% of end-stage patients experience significant fatigue, and this is often the earliest symptom to appear, sometimes showing up 12 months before death. It's not age taking away their energy, it's life withdrawing. As the body redirects energy from external activities to maintaining essential internal functions, the natural consequence is that fatigue becomes overwhelming. The most heartbreaking thing Nancy shares about her 79-year-old husband was watching him fight against it. John had always been a doer, fixing things around the house, gardening, cooking. Suddenly, he couldn't do those things anymore, and it wounded his very identity. Nancy's story isn't uncommon. For many older adults, especially generations whose identity was tied to their ability to work and contribute, this gradual loss of ability can cause a profound dignity crisis. To help maintain dignity during this phase, experts offer these suggestions. Don't impose activity on them. Instead of saying, "Try to perk up a bit," ask, "How are you feeling today? What would you like to do?" Adjust activities to match their energy levels. A 15-minute conversation might be more meaningful than a day trip that exhausts them. Create space for them to contribute in small ways, proportionate to their energy. It could be as simple as asking for advice or having them tell a story. Acknowledge their fatigue is real, not imagined or just in their head. Dr. Elizabeth Harrison, an end-of-life care expert at the University of Pennsylvania, explains, "We tend to medicalize everything in modern society, looking for medication or treatment to fix fatigue. But at this stage, understanding and accepting the reality that the body is moving into a new phase is much more important than trying to fight against it." The reality is that for many people, accepting this fatigue and helping loved ones accept it too can lead to an unexpected period of peace. As the pressure to do diminishes, the space for being expands. After John stopped fighting the fatigue, Nancy continues, "We had the best conversations of our 50-year marriage. He talked about his childhood, about his hopes for the grandchildren, about things he'd learned. We connected in a way we'd never had time for before." If your loved one is experiencing profound fatigue, especially if it's accompanied by other signs on this list, view it as an invitation to slow down, simplify, and connect on a different level. Time may be shortening, but the depth of connection can increase in surprising and valuable ways. 3. Cognitive confusion or withdrawal. Cognitive confusion is often one of the most heartbreaking changes for families to watch. Seeing someone you know well, someone sharp, intelligent, knowledgeable, begin to forget names, get lost in stories, or even fail to recognize relatives can cause deep pain. My father was a math professor. Thomas, 58, shares about his 91-year-old father. He could do calculations in his head faster than I could do them with a calculator. But about 8 months before he passed, he started struggling with simple arithmetic. Then he began forgetting dates, then names. It was really like losing my father bit by bit while he was still here. Cognitive changes can happen even when the person has no history of dementia or Alzheimer's. According to a study from the UCI Center for Aging Research, about 65% of elderly people experience some form of cognitive confusion in the final year of life, even if they had no prior diagnosis of cognitive issues. This happens for several reasons. As circulation slows, the brain doesn't receive the optimal amount of oxygen and glucose it needs. Changing body systems can also cause imbalances in chemicals and hormones that affect brain function. But there's also a special phenomenon that experts call terminal lucidity that can occur. 3 days before my grandmother passed away, she suddenly became completely lucid. Michelle, 45, recalls. For months she had been confused, not recognizing us. But suddenly, she called all of us by name, asked about our lives, and shared detailed stories from the past. Then, the next day, she went back to a confused state and passed away shortly after. This phenomenon of terminal lucidity, when patients suddenly become clear-minded for a short time before death, remains mysterious to science, but has been documented in medical literature for centuries. It reminds us that even when loved ones seem to be not there may be more going on inside than we realize. How can you communicate effectively with someone showing signs of confusion? My mother kept asking when her husband, my father who had been gone for 20 years, was coming to pick her up. Amanda, 52, shares. At first I tried to fix it by saying, "Mom, Dad is gone, don't you remember?" This only made her sad or angry. A nurse taught me to say, "You're missing Dad, aren't you? You loved him so much. Tell me about him." That opened up beautiful conversations. Dr. Harrison emphasizes the importance of remembering that emotional withdrawal can also be part of this process. Many families feel hurt when loved ones seem to lose interest in family or previous hobbies, but this is actually part of a natural withdrawal, a process called natural social withdrawal that many people experience as they begin transitioning from this life to death. Understanding these cognitive and emotional changes as part of a natural journey can help families receive them with greater compassion and understanding, rather than feeling rejected or hurt. 4. Significant unintentional weight loss. One of the earliest and most noticeable signs of the end-of-life process is unintentional weight loss, a change many families initially dismiss as a normal part of aging. My father was always big, a sturdy 6-foot-tall man, Eric, 50, recalls. But during a visit a year ago, I noticed his pants were hanging loose. When I mentioned it, he just laughed and said he was on an unintentional diet plan. We even joked about it. What Eric and his father didn't realize was that weight loss, especially when exceeding 5% of body weight over 6 months, is considered an important medical sign in elderly people. According to the American Geriatric Society, unintentional weight loss of more than 10% over a 6-month period is associated with an increased mortality risk of up to 85%. But why is weight loss so common in the end-of-life phase? There are several key reasons. First, the natural aging process leads to decreased muscle mass, but this process accelerates significantly in the final year of life. Studies show that in the last 12 months, the rate of muscle loss can increase threefold compared to normal age-related levels. Second, changes in taste and smell can reduce appetite. Dr. Sarah Johnson, a specialist in geriatric nutrition, explains, over 75% of our taste actually comes from our sense of smell. When these senses diminish, food becomes much less appealing, leading to decreased intake. Third, the body shifts how it uses energy. This is something many people don't understand. Dr. Johnson explains, in the end-of-life phase, the body actually begins shifting into conservation mode. It no longer prioritizes growth or even maintenance of tissues. It shifts to prioritizing maintaining basic functions for as long as possible. This is especially true for patients with chronic conditions like cancer, heart failure, or kidney disease. In these cases, the body may both burn calories faster and have more difficulty using nutrients due to inflammation or metabolic changes. So what should families do when they notice their loved one losing weight? My mother used to be an amazing cook, but she didn't want to eat anymore. So instead of trying to convince her to eat, we turned eating into a social activity. We held theme tasting parties where everyone had small portions and shared stories about the food. She didn't eat much, but she enjoyed being part of it, and what she did eat was higher quality. A good strategy is to work with a nutritionist experienced in end-of-life care who can help develop a plan focused on flavor, texture, and joy in eating rather than just calories. Ultimately, Dr. Johnson says, the most important thing is to respect that decreasing intake is a natural part of the end-of-life process. Many families struggle with this because food is symbolic of love and nurturing, but sometimes showing love means accepting that your loved one's body is changing and that not forcing food may actually be the more loving act. 5. Frequent infections and slow healing. One of the less noticed but alarming signs of the end-of-life phase is a declining ability to fight infections and heal wounds. My mother rarely got sick. Patricia, 63, shares about her 92-year-old mother. Even when the whole family had the flu, she was usually the only one who didn't get it. So when she kept getting pneumonia, one time after another over a few months, we knew something had fundamentally changed. The immune system, like every other system in the body, weakens with age. But in the final year of life, this decline often accelerates significantly. According to Johns Hopkins University, elderly people in the end-of-life phase have an infection rate up to 50% higher than age-matched peers, not in the end-of-life phase. The most common types of infections include pneumonia and upper respiratory infections, urinary tract infections, UTIs, skin infections, including pressure ulcers, gastrointestinal infections, oral and gum infections. It's important to note that infections in the elderly often present differently than in younger people. Instead of high fever, elderly individuals may have only a slight temperature increase, or even lower than normal temperature. Instead of specific pain, they may only show confusion, disorientation, or increased fatigue. Dr. Michael Reynolds, an infectious disease physician focusing on elderly care, explains, families often don't realize that a sudden change in behavior or alertness in an elderly person is frequently the first sign of infection. If your parent or grandparent suddenly becomes more confused than usual, there's good reason to suspect a UTI or other infection, even without classic symptoms. Beyond infections, healing ability is significantly diminished. Small cuts or scrapes can take weeks to heal, rather than days. Bruises appear more easily and last longer. These are all signs that the body's self-repair processes are slowing down. One notable observation is that antibiotics often don't work as well as they once did. Joseph, 68, recalls about his father. Dad used to respond well to antibiotics, but in those final months, even strong antibiotics couldn't fully clear infections. The doctor explained that this happens partly because his immune system wasn't cooperating with the medication anymore. This raises important ethical questions for families and medical teams. When is aggressive treatment of infections appropriate? And when should the approach shift to a gentler one, focused on comfort? Dr. Reynolds suggests a thoughtful approach. Many studies show that for elderly people in the end-of-life phase, aggressive treatment of infections doesn't necessarily extend life or improve quality of life. In some cases, it may prolong discomfort through invasive procedures, medication side effects, and hospital stays. Instead, he advises families to work closely with the medical team to develop a personalized plan focused on the patient's goals and values. For some people, this might mean treating infections with a gentler approach, perhaps oral antibiotics at home instead of hospitalization. For others, it means focusing entirely on symptom control and ensuring comfort. Reynolds says, is understand that these recurrent infections aren't a failure on their part. This is part of the natural process as the body begins concluding its journey. Final thoughts. As we conclude our discussion of these 5 warning signs, I want to emphasize one thing. Awareness isn't for fear, but for preparation. Understanding that these changes are part of a natural journey can help transform a loved one's final time from a period of panic and confusion into a meaningful, purposeful time. Perhaps you've recognized one or more of these signs in your loved one. If so, see this not as a reason for despair, but as an opportunity to ask the important question, how can we make the most of the time we have left? Joanne, 59, shares how recognizing these signs in her mother changed the entire experience for her family. Instead of living in denial, then suddenly being shocked, we had time to adjust, to say goodbye, to resolve unfinished business. I even held a living wake where people came to share memories with Mom while she was still here to enjoy it. It was the most precious gift I could imagine. The issue isn't the number of days left, but the quality of each day. With an open heart and understanding of what's happening, you can help ensure your loved one's final time is filled with dignity, comfort, and love. This may be one of the most meaningful gifts you'll ever give, the gift of acceptance, presence, and devoted support. Elizabeth Kubler-Ross, the author who devoted her career to understanding death and dying, once wrote, "It's not the people in your life, it's the life in your people." Remember this as you accompany your loved one on their final journey. And if you're reading this because you're concerned about a loved one, know that you're not alone. Millions of families have walked this path before you, and while it's never easy, knowing what's happening can help you find the strength, patience, and peace you need to be the loving presence your loved one deserves. Thank you for taking the time to watch this video today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you found this video helpful, please like, subscribe, and share. Your support helps us continue creating quality content to inform and inspire you. Thanks for watching, and we look forward to seeing you in our next video.